In the heart of East Africa lies a nation with a deep commitment to improving its healthcare landscape through digital innovation.
Digitization is one of our 4 of the pillars of universal health coverage. So as a means to then we are leveraging on the technology to be able to provide services to Kenyans.
As early as 1972, Kenya's Ministry of Health recognized the need for a robust health information system. Over the next decade, the MOH led Kenya's health sector on a journey of coordination and development, decentralizing the health information system. But it wasn't until the mid-80s to early 2002 that Kenya witnessed a surge in the implementation of electronic health information systems, HIS, leading to a proliferation of non-standardized and interoperable systems.
Before 2010, we had multiple EMRs existing in the country. The Ministry of Health came in and developed EMR standards and guidelines. Those guidelines were launched, and we conducted an assessment around the same time and just found only 4 EMRs were conforming to those standards and guidelines.
The results of these assessments paved the way for a new era of standardized national reporting systems.
After NASCOP selected the electronic medical record systems, Palladium under the Kenya GMRs project was mandated with expanding these EMRs to conform with the guidelines a bit more.
The devolved governance established in Kenya's 2010 constitution further emphasized the importance of tailored HIS implementation at the county level.
I can track 3 systems that we used to migrate information. The first system was from CPAD to IQ Care, which still we lost a lot of information of the patient. Now we had to go back again to the files because things like registers where the files could maybe be documented were still in the hands of other people. Kenya EMR came in place in the year 2020 around November, and we managed now to completely migrate our patient data from the old IQ Care system to the Kenya EMR.
Initially, we would move through files. So you'd peruse through the files. Of course, some leaves can lack off and disappear, giving now incomplete information. But with the advent of EMR, just with a tablet or a laptop, you are able to have the CCC number of a client, and you click and you have everything at a glance.
Digitization is capital intensive in terms of hardware and software. So for this reason, we've collaborated with different partners to ensure that the digitization agenda is articulated.
The government now, under its agenda of universal health coverage, has invested in programs and plans that are geared towards achieving universal healthcare coverage. We want a patient to have the journey of his or her treatment to be digitized, to move without necessarily moving with the cards as before they used to do, those exercise books where the doctor will write something. So we are saying whatever the doctor is going now to prescribe will also be in the system.
We have trained both technical, that is the nurses, the clinical officers, the lab technicians, the pharmacists, the doctors, but also the non-technical, really to be able to uptake these EMR services.
From 2012 to 2015, these EMRs were rolled out using US President's Emergency Fund for AIDS Response, PEPFAR. By 2016, there were over 642 EMR facilities for use by data clerks for data capture and reporting in large HIV clinics.
All things are synchronized into one, meaning at a visit like today, you're able to see all the services a client is due. You're able to send your client to the lab without using the hard copy paper. The client can come back and then you send to the pharmacy. And you're able to see the due services.
The support is more on the HIV, but now there's that kind of scale up. I'm looking forward where we'll have this system in the inpatient ward.
The EMR systems are integrated with the Health Information Superhighway through the National Client Registry (CR), National Health Data Dictionary (NHDD), and the National Shared Health Records (SHR).
we have developed the digital health bill. We want this data of our patient to be accessed where the patient has given the rights to the facility to access that data. So this data will be stored in what's called the patient registry.
These systems are expected to drive critical reforms in health service delivery.
As Concert Technopolis, we've provided that cloud compute environment, which now ensures that the systems are able to interoperate and therefore provide a more synergistic approach to digitization of the health system.
The COVID-19 pandemic acted as a catalyst for innovation, leading to solutions like Chanjo KE and other disease surveillance digital health tools. These tools are now being modernized.
One of the things that we worked on was to establish how this data would come in, and this was through digitization of the tools that we used using the cloud EMR. And the impact of this has been you're able to make decisions probably when interventions need to be put in place.
We have already developed an ERP, an enterprise resource program that is going to encompass and digitize using technology most of the county services, including a hospital management system. The stocks in every facility that can be seen at the touch of a button in every facility.
We have organized the facilities in a primary care network. It's a hub and spoke model. So a specialist sitting at level 4 hospital is able to provide support to a patient who is in a spoke that could be a level 2 or a level 3 hospital.
The future holds the promise of artificial intelligence, where AI-enabled digital health systems are emerging to further enhance healthcare delivery.
We are leveraging the artificial intelligence and machine learning to start to predict trends for our patient. Maybe this patient needs to be linked to other services.
So we shall be working with other government agencies as AI evolves, and we are going to see a simplified kind of lifestyle where information is available and people are even able to promote health and wellness based on availability of information on the digital gadgets.
Kenya's commitment to health digitization is paving the way for a healthier and more connected nation through committed leadership, partnership, and great determination to the realization of the highest attainable standard of care for every Kenyan.
I believe one of the easiest ways in which we are going to work around our challenges in health is through digitization. We are shifting the delivery of healthcare in this country. Afya yetu ni jukumu letu.